Welcome to the Explainer. So, today we're going to talk about chronic low back pain. We'll get into why it happens, and maybe more importantly, when you should actually be worried. The whole point here is to give you answers that build your confidence, not, build more fear.
So many of us have heard words just like these. And you probably remember that sinking feeling in the doctor's office, right? That moment where you think, okay, so it is broken. This is never going to get better. It's a really common experience. And it just leaves you with this picture in your mind of a fragile, crumbling spine. Well, today we're going to completely reframe that whole picture. We're going to dig into why your back actually hurts and what that pain might be trying to tell you. This is all about swapping out fear for knowledge so you can really start moving forward with some confidence. All right, so why does your back really hurt? It's complicated, and you know what? That's totally normal. When we think about back pain, we always want to find that one single culprit, right? Like that one bad disc. But the lower back is this incredibly complex, really strong structure. And the truth is, pain almost never comes from just one spot. Okay, so let's start with the discs. Think of these as the little cushions or shock absorbers between the bones in your spine. What can happen is, over time, tiny little cracks can develop, and nerves can actually grow into them. And it turns out, they're involved in something like 26 to 42% of chronic low back pain cases.
All right, next up, we've got the facet joints. These are these small joints on the back of your spine that, they help you twist and bend. And guess what? Just like your knee, they can get arthritis. They're a factor in about 15 to 45% of cases.
Then there are the sacroiliac joints, or SI joints for short. These are the ones that connect the very base of your spine to your pelvis. And when they're the ones acting up, which happens about 10 to 30% of the time, there's often this telltale sign, a pain in one buttock that's so specific you can point to it with just one finger. And of course, we can't forget about the muscles and that connective tissue called fascia. Overuse, stress, even just the way you sit, it can all create these tight, tender little knots, we call them trigger points, that can make you feel pain in totally different areas. This is a huge, extremely common contributor.
So here's the really crucial point. It's totally, 100% normal for your pain to come from a mix of all these different sources. The fact that you can't pinpoint one single broken part, that doesn't mean your diagnosis is wrong. Actually, it probably means your diagnosis is spot on.
Okay, but here's where it gets even more interesting. When pain sticks around for a while, weeks, months, your whole nervous system can kind of shift into this high alert state. It really is like someone turned up the volume dial on your pain processing. It's like a smoke alarm that's gotten so sensitive, it now goes off every single time you just make toast. And let me be super clear, this is not all in your head. It's a real, measurable physiological change. The technical term is nocioplastic pain, or you might hear central sensitization. All it means is that your nervous system has learned to be overprotective. It's amplifying signals. And this, right here, is why things like stress or a bad night's sleep can suddenly make your pain feel so much worse, because it's all connected through that same sensitized nervous system. Okay, this next part, this brings us to what might be the single most important idea in this entire explainer. Seriously, it's a shift in thinking that can absolutely change your entire relationship with pain. So, 96%. What on earth is that? Well, that is the percentage of completely pain-free 80-year-olds who have disc degeneration show up on an MRI. 96%. Just let that sink in for a second. What that tells us is that disc degeneration is basically like gray hair or wrinkles. It's a totally normal, expected part of aging. It is not necessarily a sign of a problem. So this really leaves us with a choice between two different ways of thinking. On one side, you've got the old, fear-based mindset. The one that says, if it hurts, it must be damaged, or my MRI defines my future, I have to rest and protect my back. But the new understanding is all about confidence. It says pain is an alarm, not a damage meter. Your scan, it's just one tiny piece of the puzzle. And the most important part, it's safe to move. In fact, movement is medicine. The core message here, really, is this. Your body is so much stronger and more resilient than you probably think. Your spine isn't some fragile stack of plates that's just waiting to crumble. No way. It's an incredibly strong, adaptable structure. And learning to trust it again, wow, that is a massive step towards recovery. Okay, so if most pain isn't a sign of some serious damage, you're probably asking,
When should I be worried? When do I need to talk to a doctor? That's a great question. So let's clarify the few very specific signs that do warrant a prompt conversation.
Now, before we go on, I want to be really clear about something. The goal here is absolutely not to make you anxious. It's the total opposite. The idea is that when you know exactly what the real serious warning signs are, you can stop worrying about everything else. It's about giving you peace of mind.
So here they are. First is what we call night pain, pain that actually wakes you up from sleep and doesn't get better when you move around or change position. Second, unexplained weight loss, so losing weight when you're not trying to. Third, having back pain combined with a fever. Fourth is any widespread numbness, especially in the area where you'd sit on a saddle, or, and this is an important one, any new problems with bowel or bladder control. That one needs urgent evaluation. And finally, number 5, pain that is just relentlessly getting worse, day after day, for over a month, no matter what you try.
And this is the really important part. If that list doesn't apply to you, the chances of a serious underlying condition are incredibly low. See, doctors check for these red flags first. So if you've been checked out and these don't fit your situation, you can be really reassured that the scary stuff has been ruled out. And now you can shift your focus from worrying to actually recovering.
All right, so let's just do a super quick recap of the big ideas. Number 1, back pain has lots of sources, and that's normal. 2, your nervous system can get kind of sensitized or overprotective. 3, and this is the big one, pain does not mean damage. 4, it is absolutely safe and helpful to move. And finally, know those few real warning signs, and then you can let go of the rest of the worry.
So that brings us to a final thought, a question for you. Now that you know that the really serious things have most likely been ruled out, what's one small, enjoyable movement you can bring back into your life this week? And look, this isn't about pushing through pain. It's about reintroducing joy. Maybe it's just a short walk in the park. Maybe it's doing a little bit of gardening, or even just dancing in your kitchen. What's that one small, pleasant thing you can reclaim with this new confidence? Because that's where the journey back to really living your life begins.